Hello everyone, this is John, bringing you the latest news from the healthcare front in the UK. Today we're diving into an explosive report by Lord Darzi that lays bare the dire state of the NHS. With waiting lists soaring and A&E departments under immense pressure, this report has sparked a national debate on the future of our healthcare system. Before we delve into the details, don't forget to hit the like button, subscribe to the channel, and join our rapidly growing community for more insightful updates on current events and politics. Lord Darzi's report has sent shockwaves through the UK, highlighting the awful state of A&E departments, with long waits contributing to an estimated 14,000 extra deaths annually. The Prime Minister, Keir Starmer, revealed that over 100,000 infants waited more than 6 hours last year, with nearly a tenth of all patients waiting 12 hours or more, leading to thousands of avoidable deaths. The report also underscores the impact of lengthy waits for urgent treatment on cancer death rates and mental health issues. Starmer noted that many people with mental health issues wait over a year for care, adding to the growing frustration among the public. So, how much have waiting lists increased in recent years? As this graph shows, the number of people waiting more than a year for hospital treatment has almost doubled from about 4 million to almost 8 million between 2018 August 2007 and June 2024. Additionally, the number of patients waiting up to 18 weeks has also doubled from about 2 million to more than 4 million in the same period. Professor Camilla Hawthorne, chair of the Royal College of General Practitioners, welcomed the report, stating that GPs are ready for significant reforms. As GPs, we are absolutely up for it. It's time to reset how we deliver health in our country, she said on BBC Radio 4's World at One programme. Hawthorne also highlighted the challenges faced by GPs, with many leaving the profession faster than they are entering it. Independent MP Jeremy Corbyn criticised the privatisation of the health system, estimating that since 2012, the NHS has lost £10 million every week to private healthcare profits. He called for an end to outsourcing and a reversal of privatisation to restore a publicly owned NHS for all. The report has also prompted discussions about healthcare spending. While UK health spending has seen an average increase of about 4% per year since the 1950s, Starmer made it clear that problems in the NHS will not be solved by extra funding alone. We can't duck long-term change, he said, emphasising the need for reform. Several charities have welcomed the report, with the Chartered Society of Physiotherapy noting that community rehab keeps people out of hospitals. Mental health charity Mind called the report a dark day for mental health, highlighting the dire conditions in which people in mental health crises are being held. SNP Westminster leader Stephen Flynn criticised the UK for lagging behind European neighbours on healthcare investment and staffing, warning that without urgent funding, the NHS will be further damaged. The Green Party accused Labour of being hooked on reform rather than investment, suggesting that wealth taxes could generate billions for the NHS. The latest NHS performance data for England reveals overall waiting list. The size of the waiting list for routine hospital treatment remained unchanged in July, with an estimated 7.62 million treatments waiting to be carried out. At the end of July, some 2,738 patients were waiting more than 18 months to start routine treatment. Accident and emergency waits. In August, 28,494 people waited more than 12 hours in A&E departments from a decision being made to admit to actual admission. Cancer referrals. 76.2% of urgent cancer referrals in July were diagnosed or had cancer ruled out within 28 days, slightly down from 76.3% the previous month, but above the target of 75%. Comparing NHS England and Wales. Shadow Health Secretary Victoria Atkins criticised the Darzi report for not comparing the performance of NHS England to the Labour-run NHS in Wales. She claimed that 1 in 4 of the Welsh population is on NHS waiting lists, with patients waiting 7 weeks longer than in England. However, comparing the two systems is complex due to differences in recording performance and demographic factors. Lib Dems and Conservative responses. The Liberal Democrats cast Lord Darzi's report as a summary of the Tories' impact on the NHS, criticising it for being long on diagnosis and short on prescription. Lib Dem health spokeswoman Daisy Cooper called for a shift from hospitals to high street and from treatment to prevention. Shadow Health Secretary Victoria Atkins urged MPs to talk constructively about the health service's future, noting that the NHS belongs to all of us. She acknowledged the challenges faced during the coalition government of the 2010s, but emphasised the need for reform and modernisation. Public satisfaction with the NHS. Keir Starmer noted that public satisfaction in the NHS has fallen from an all-time high when the last Labour government left office to an all-time low today. The British Social Attitude Survey shows that in 2010, 70% of the public were very or quite satisfied with the NHS, compared to 24% currently. Conclusion: the road ahead for the NHS. Lord Darzi's report has laid bare the challenges facing the NHS and has prompted a national debate on its future. With waiting lists soaring and A&E departments under immense pressure, the road ahead is anything but smooth. Starmer has promised big reforms, including investment in digital technologies, more community care, and a focus on prevention. However, the funding for these reforms remains unclear. Closing thoughts. The events surrounding Lord Darzi's report have highlighted the urgent need for reform within the NHS. With public opinion shifting and traditional supporters growing increasingly frustrated, the road ahead for the NHS is fraught with challenges. Moments like this will continue to shape the narrative around the future of our healthcare system. As we look ahead to the next general election, Starmer faces an uphill battle. The public perception of his leadership is clearly in flux, and incidents like this one will only add to the pressure. Can Starmer pivot and regain the trust of disillusioned voters, or is Labour headed for further decline under his leadership? This is the question that will be on many people's minds in the coming months. The Labour Party's future may depend on how Starmer addresses these growing concerns and whether he can bridge the gap between his party's policies and the needs of the British public. Thank you for joining us today. Stay informed and engaged with the latest developments in UK healthcare and politics. Don't forget to like, share and subscribe for more insightful content. See you next time. What do you think? Is this just a temporary setback for the NHS, or does it signal a deeper crisis? Let us know your thoughts in the comments below, and don't forget to like and subscribe for more updates on this developing story. Thank you for watching, and stay tuned for more British news and analysis.